Hi everyone, I wanted to talk today a little bit about blood pressure. So when you take a blood pressure, there's two numbers. There's the systolic, that's the top number or the highest number, and it's over the diastolic, that's the lower number. When you're taking a blood pressure, you want to have somebody with around 120 over 80. So the squeezing, the highest number is going to be 120, the bottom number is going to be around 80, so the relaxing. If you bump into somebody that has a number that's over 140 above, and over 90 on the bottom, either number, if they're high, we need to know about it at the office. If you run into someone that is lower than their top number being a 90 and their bottom number being a 60, so if somebody had 84 over 66, please phone the office. Those people have low blood pressure. The odd part about the blood pressure is that if it's high and if it's low, there's very similar symptoms. So if you're out seeing somebody and they're dizzy, they can have difficulty ambulating. They can have headaches. You'll see sometimes they'll have a chronic kidney condition, so you'll already know about that. That's a hint that there's been blood pressure problems for an extended period of time. So keeping those things in mind, they are at a very much higher risk of kidney disease, of stroke, of heart attack, and you're going to be watching out for any extra symptoms. So if it's someone that has headaches constantly, you're going to know that there's something wrong. If you check their blood pressure and it's high, call the office. We need to know right away. It needs to be dealt with. So it can be dealt with through medications. If it's a low blood pressure, it could be that they're extremely dehydrated, not enough blood in their body to push around, so the pressure is not that high, like a water balloon being full of water. Pressure's not that high when you are filling it up. So let's talk a little bit about causes. There can be high salt diets, there can be hereditary causes, and there can also be medication. So if they're on a medication for high blood pressure and you take their blood pressure and it is 70 over 40, I mean, they're probably going to be asleep, but if it's 100 over 60, then you're going to let us know, and you're going to say it's a little bit on the low side, and they're pretty tired these days. They are on a blood pressure medication. Not all doses are forever, so make sure we would then contact the doctor, make sure that it's the right dose for the right person for the right time, and then we can discontinue or reassess based on that. Now, to get to the nitty-gritty, let's talk about blood pressure machines. This is sort of your bog standard fella right here. A Life brand one from the pharmacy. They're about $40, and clients will have them in their home. Sometimes we will bring them out with us when I do a wellness check. I'll have it with me. It's pretty easy. There's really only a couple of buttons. You've got your history and you've got your on button, and this is the memory, so it's storing it. Batteries in the back. If it doesn't turn on when you press this button, it's probably the batteries in the back. And then there's a little hole on the side, and I'll show you where this goes. So you have your cuff. The cuff is going to be the right size for the person. If you have a very large person, they will need a bigger cuff. And it's a bariatric cuff. They are a specialty product, so they may have it, they may not. If it doesn't go around properly into the right index size on here, and we'll go over that, then it's not the right cuff. If you have someone that has very thin arms, very slender creature, then you're going to want a smaller one. And there's pediatric ones as well. You've probably seen them if you have kids. So there's all different sizes. So first off, make sure it's the right size. Second off, you want to make sure every time that you use it, if this is one that goes from home to home, it's being sanitized. So make sure it's sanitized. If you're not sure, sanitize it. Again, it's not going to cause any harm for it to be sanitized. Just don't put it on the person when it's still wet. Now, this is going to go, sometimes they will say, this is a left arm one. So there can be left, there can be right, and there can be bilateral. It depends on the fit of this. Now this one is actually built for it to be put on yourself. So the markers here says artery mark. Now I know my artery is in here, so I'm going to be putting my artery mark, lining it up as tight as I can with that. And then you're going to pull the blood pressure cuff around, making sure the artery mark stays in the right location as much as possible. You're going to pull it. It doesn't have to be super tight. You don't want to cut circulation off yet, but you will in a minute. You're going to pull it all the way around checking, there's an index again. So this is the left arm. We're talking about where we're lining up. There is a picture on here, so it's pretty easy to follow. But if there isn't, again, left or right, sometimes you're going to want to know, has this person had a mastectomy? Because there can be impaired circulation. You don't want to do it on the side that the mastectomy has happened on. If they have wounds, you're not going to want to put it on a wound. If they need their blood pressure taken, then you're going to do the other side. If they have a fracture or an injury of any respect on that side, do not do the blood pressure. Do it on the other side. And then some people can say, you know what? I don't want it on that side, put it on the other side. It's not going to make a big difference. Some people do have a difference in their blood pressure because they have had previous surgery that's impaired circulation and they're aware of that. Sometimes you can do a blood pressure on one arm and get a completely different one on the other. So everybody's different. Again, history will tell us a little bit more and give us a better idea as to whether the reading is what we are looking for. So you're going to want to plug it in, make sure it's a nice tight fit. Then you're going to push your button, or the batteries are going to be dead or missing. There we go. There we go. All right. We'll put that back together. Now, get the person to relax and don't let them talk. So this reading's going to be a little bit skewed. If you have somebody that's talking or anxious, the numbers are going to be a little bit higher. You want them to relax their arm down when the blood pressure is being taken, okay? So let them talk. Stop them talking while it's going on. And it's going to tick down. It may be uncomfortable for some people, especially if it's going up quite high. It squeezes harder if you have higher blood pressure because it's trying to cut the circulation off to your arm to get an idea of how much pressure is being put on your body. There we go. 117/81. It also gives you a pulse rate, and you're going to record this in your documentation. So if there is a vital signs record that you're keeping in the home, do that. If there isn't, then you write it down in the communication notes. If it's high, call the office. If you don't know how to interpret the number, call the office. If you have any questions at all or you want to talk to us, call the office. We are here to help. And then again, because I used it, I'm going to sanitize. I take the battery out when I'm traveling because I tend to hear it making noise in the back of my car. So that's why the batteries are out. But if you have any questions at all, please give us a call. We are always here for you. And I hope this was of some help. And have a great day. Bye.